Hello, my name is Javier Encinas, and today we're going to be going over the case study number 2 for the class PUBH 5851 Health. Today's task for me has been to be appointed as the World Health Organization Director General. Today's case study has to do with the COVID-19 pandemic. Let's move along. The case. On December 31st of 2019, China reported a cluster of cases of pneumonia in people associated with the seafood wholesale market in Wuhan, Hubei province. On January 7, 2020, the Chinese health authorities confirmed that this cluster was associated with a novel coronavirus. Since then, over 6.75 million cases have been confirmed as of June 5th, with over 393,000 deaths across 210 countries. With my role being the World Health Organization Director General, let's go over real quick about what exactly is the World Health Organization, or also known as the WHO. The WHO is an agency of the United Nations specialized in the highest level of international public health. The World Health Organization was established on April 7th of 1948. Its headquarters are in Geneva, Switzerland. The World Health Assembly, also known as the WHO, is its governing body, led by no other than the WHO Director General, who I will be playing today. Amongst notable past achievements of the WHO are the eradication of smallpox, the near eradication of polio, and the development of the Ebola vaccine. It currently prioritizes major communicable diseases such as HIV/AIDS, COVID-19, tuberculosis, Ebola, and malaria. Now let's go over who exactly is the World Health Organization Director General and what are his duties. The WHO Director General is the face of the COVID-19 pandemic response on a global scale. He is considered the main leader of the World Health Organization. His role is to lead and supervise the decisions, provide guidelines, and responses to all global health issues. For example, the COVID-19 pandemic. He can be elected for a maximum of 2 5-year terms. He is appointed by and is responsible for the World Health Assembly, which is the decision-making body of the WHO. He's also in charge of the review and approval of the budget and all financial policies and decisions of the World Health Organization. Currently, the real Director General of the World Health Organization is Dr. Tedros Adhanom Ghebreyesus, an Ethiopian biologist and public health researcher who was appointed in 2017. He has also been in charge of most of the overseeing and response to the current COVID-19 pandemic. Now let's take a look at the case and the task at hand. On December 31st, 2019, China reported a cluster of cases of pneumonia in Wuhan. On this date, the World Health Organization was alerted about the outbreak, and I, as the Director General of the World Health Organization, will be alerted of this information and will start appointing people and teams to gather more information and explore further the situation. On January 7th, a week later, 2020, the Chinese health authorities confirmed that this cluster was associated with the novel coronavirus. The World Health Organization is aware and becomes involved in the outbreak, now that it is confirmed that this is a new novel coronavirus. As the World Health Organization Director General, I will assemble a team to further assess and explore and gather samples of the virus and study it further in depth. This is in order to create and generate further plans, decisions, and see what this virus implies. On January 22nd, the World Health Organization has now confirmed that human-to-human transmission of the virus is how it spreads. As the Director General, I will review the health safety guidelines and will release further information to the public about this novel coronavirus, including now more available information such as symptoms, spreadability, and the number of cases known thus far. And I will continue to give updates and more statistical information as it becomes readily available to the public. On January 31st of 2020, the World Health Organization has now officially declared the coronavirus outbreak a public health emergency of international concern. This is because after looking at the number of cases, as of January 30, there have been 9,976 cases that have been reported in at least 21 countries, including the first confirmed case of COVID-19 infection in the United States, reported on January 20, 2020. As the World Health Organization Director General, I will appoint multiple diplomatic teams to provide strategic advice and high-level political advocacy and engagement in different parts of the world about the COVID-19 situation. Especially now that this outbreak now involves multiple countries and has escalated to international levels. March 11th, the World Health Organization declared the COVID-19 outbreak a global pandemic. Globally, confirmed cases of COVID-19 now have topped 118,000 by March 11, while reported deaths were fewer than 5,000. On March 15th, the US began to shut down in order to prevent the spread of the coronavirus. As the Director General, I have declared Europe as the center of the pandemic, given its high infection rate and death toll number. As the Director General, I have also started to create programs for clinical trials to formulate a pandemic response. As Director General, I have started to recommend quarantine measures to those who are sick or are experiencing symptoms in all affected countries, as well as considering social distancing and other health guideline measures. As of April 4th, 2020, more than 1 million cases have been confirmed around the world. That is a tenfold from the prior month. As the Director General, I started to approve new guidelines for simple safety measures. Now that we know more of the virus, I start warning about spreadability and close contacts. Highly recommend social distancing and preventing hygiene measures, even if not showing any symptoms at all, as well as complete quarantine if you're experiencing symptoms. As of April 24th, over 2.7 million cases have been confirmed with over 194,000 deaths across 185 countries. As the Director General, now I'm working with the United Nations to provide relief and humanitarian responses to most nations in need, as a lot of these nations have now shut down and are going through very difficult times. Studies and clinical trials are now showing that wearing face masks can reduce transmission, as well as social distancing and other health guidelines. And therefore, the World Health Organization encourages everyone to wear a face mask when in contact with another individual or any public indoor environment. New information now also tells us that if you are ill, the recommended quarantine time is 14 days. As of June 5th, over 6.75 million cases have been confirmed with over 393,000 deaths across 210 countries. The World Health Organization and me, as the Director General, have continued to encourage social distancing, quarantine for those who are ill, and are continuing to update the public about any other findings, as well as new cases and statistics. Now, providing health workers with proper equipment has become a priority in every country. As the Director General, I will continue to work alongside with the United Nations, the CDC of the US, and other world agencies to further assess the COVID-19 pandemic and provide more health guidelines, information, and health updates to the rest of the world. As this pandemic continues to grow and involve more countries and more cases and continue to trend up its death toll, the main mission of the World Health Organization moving forward is to create an appropriate response for this novel coronavirus and stop its spread and try to bring down the number of deaths. This involves more testing available to the public so that cases can be properly detected, as well as development of vaccines to prevent infections, new discoveries on efficient treatments to treat hospitalized patients, proper provision of protective equipment for health workers across the globe, as well as provision of life-saving equipment for patient treatment. These have been our priorities, and we hope that we can continue to move forward and help the public